Hi, I'm Dr. Kathy from Rainbow Kids Urgent Care, and I will be talking about febrile seizures. So what is a febrile seizure? A febrile seizure is a kind of seizure that affects an otherwise healthy child with a fever. A fever is anything more than 100.4 degrees Fahrenheit. So when do these febrile seizures happen? Febrile seizures tend to affect about 3% of children and can occur anytime between 6 months and 5 years of age, although typically children between 12 to 18 months of age are affected. So why do they happen? They likely happen because of a vulnerability in the developing brain to the effects of fever in a child under the age of 6. Certainly some viruses like the flu will increase the chance of your child having a febrile seizure, but a family history of febrile seizures also increases that risk. What do you do if a child has a febrile seizure? Place them gently on the floor or on a bed away from any sharp or hard objects. Gently turn your child on their side so that any saliva or vomit can drain from their mouth and not choke them. Do not put anything in their mouth. You want to call your child's doctor, and if the seizure does not stop after 5 minutes, you want to call 911. At this point, I think it's important to note that there is a difference between a simple febrile seizure and a complex febrile seizure. A simple febrile seizure is one that causes shaking of the whole body, lasts less than 15 minutes, and only occurs one time in 24 hours. A complex febrile seizure happens more than once in 24 hours, causes shaking of only one part of the body, and tends to last longer than 15 minutes. Children with complex febrile seizures tend to have a higher risk of developing epilepsy. So are there any tests that need to be done? In general, children who have simple febrile seizures and are now back to baseline, which means back to their normal behavior before they even had a seizure or fever, do not need any testing. No lab work, no imaging. However, it is important to be evaluated because children with complex febrile seizures will need additional testing. Some of the most important things to note is what is the cause of the fever. So if there's a worry about a UTI, for example, there will be tests that are done for that reason. Does my child need treatment for these seizures? In general, these seizures last about 1 to 2 minutes, so treatment is not necessary. However, if your child has a prolonged or repetitive seizure, then treatment may be necessary. How can I prevent a febrile seizure from happening? Febrile seizures cannot be prevented by giving your child cool baths or giving them over-the-counter medications like Tylenol or ibuprofen. However, there is evidence that breastfeeding can prevent febrile seizures in children under the age of 2. A lot of parents will ask, are febrile seizures dangerous? Febrile seizures are undoubtedly very scary. However, they're usually harmless to the child. Thank you so much for taking the time to listen today. If you have any questions at all, please do not hesitate to reach out to Rainbow Kids Urgent Care. Bye.